Hi everyone, it's Dr. Dave Morris with Magnolia Medical Center and MagMed TV. Today we're going to be talking about one of the underlying causes of things such as migraine headaches, autoimmune disorders like rheumatoid arthritis, fibromyalgia, gut issues. If you eat and every time you eat something and you're not even sure what you eat, but you end up with a food baby every time you eat, you're going to want to watch this. We're going to talk about a digestive issue today that is extremely common. About 80% of the people that come in to see us for issues with their metabolic processes, they can't lose weight, things like that. About 80% of people that come to see us have this. And so we're going to talk about it. It's going to be about a 2 to 3 minute video. So hold on there for just a second. We'll be right back. We're going to go over this topic regarding this digestive problem. Today we are talking about something called small intestinal bacterial overgrowth, or SIBO for short. So bacteria should not really be growing in your small intestine. Bacteria that you should have lots and lots and lots of, about 10 trillion bacteria live in your large intestine. Most of those are there to help you digest food and absorb nutrients and help you deal with hormones in your body. So we're supposed to have lots of bacteria in our large intestine, not really supposed to have any in our small intestine, hence small intestinal bacterial overgrowth. Overgrowth bacteria in our small intestines. This can be a real problem, all right? And I'm going to go over some of the symptoms, the diagnosis of this, and the treatment for it. It's not something that's hard to get rid of, but you do have to find the underlying causes. So some of the symptoms are abdominal pain. So having abdominal pain is not normal. A lot of people just have this and they think that it's normal, that they have pain in their gut after they eat and during the day. Not normal. Bloating and distension. I mean, golly, there's a commercial for are you bloated? There's a commercial for that, or for a medication for that on television like every 6 minutes or something. So many people suffer with all this bloating and distension, especially after they eat. It's not normal at all. That's not supposed to occur. You're not supposed to have that food baby after you eat, unless of course you ate 10 pounds of food, which that's a different problem. Diarrhea and constipation. So depending on what type of bacteria in your small intestines is overgrown, it could determine whether or not you have diarrhea, constipation. Gas, belching, flatulence. Folks, how many people have that? Okay, it's definitely not normal. You know, if your spouse or your significant other is passing abnormal amounts of foul-smelling gas, pretty good chance that they've got SIBO. And it should be checked for because it causes so many other symptoms. People are miserable based on digestive issues. And, you know, one of the things that we didn't talk about in the beginning of this is this type of problem, SIBO, is contributed to a lot of mental issues. Or it can affect the brain. The brain and the gut are very closely connected. So depression, anxiety, a lot of mental issues, ADD, ADHD, a lot of these things can be attributed to and be caused by small intestinal bacterial overgrowth. So it's not something you just want to let go if somebody's having a lot of symptoms like this. There's something that can be done about that. Diagnosis. Well, there's two ways that have been, the main way that was used for a really long time is a breath test. Now, this isn't used as frequently anymore. They found out it gives a lot of false negatives, but this is the standard medical way of looking for SIBO, is a breath test. We use a stool test. Not a lot of fun to do a stool test, but it is accurate, it's reliable. We look at all the different bacteria and the microbiota that live in your gut, the good ones and the bad ones. As I mentioned, you should have about 10 trillion bacteria that live in your intestines. Most of those are supposed to be good for you, help you digest food, help your brain work right, and all those good things. But we can look for this type of problem, SIBO, by looking at that the stool test to determine what are little critters doing that live in your gut, and if there's bad ones there, you can do something about it. Treatment. Typical medical treatment is an antibiotic called rifaximin. Now, rifaximin is typically not covered by insurance, typically not approved by insurance. One of the good things about rifaximin is it typically is not absorbed into the bloodstream, so it stays in your gut and goes to work killing those bacteria that don't belong. The bad news about rifaximin is it can kill and does kill a lot of the good bacteria that live in your gut. And the other bad news about rifaximin is, again, it's not covered by insurance, and it typically costs around over $500. So not a great option there. Another product was studied and kind of tested against rifaximin and found to actually work better, and it's called FC-Cytal, and it's something that we use in our clinic if somebody has SIBO, and it costs about $28. So obviously that's the one we'd want to use. Now, one of the things you need to know about this is neither of these two solutions will work if you don't find the underlying reasons why somebody would have gotten SIBO in the first place and why they've got it, because your immune system should be working at handling these infections in your body, should be fighting these things off. So if you have SIBO, it's easy to eradicate these things, but it's not as easy to look for the long-term solutions. If you have digestive issues, you have problems with your digestive tract, if you're having joint pains, if you're getting lots of headaches, if you have lots of food sensitivities, if you suspect you might have leaky gut, if you're just suffering with digestive problems, you should watch our full-length video on digestive problems. This is, I don't know, it's maybe 45 minutes long. I'll put the link to it in the comments below. And this video is extremely educational on a lot of the underlying reasons why people have GI issues and what can be done about it. You have to look for all their underlying causes. And, we're passionate about helping people, especially if it can help them stay off medications that can be detrimental to their health and cause lots of side effects. We love it when people get better and they stop suffering and they can enjoy their life again. So many people are just spending their life at home and near the bathroom because of all these digestive issues, and there are solutions to it. So watch our full-length video on that. I'll put a link to that in the comments below. We appreciate you watching. We want you to stay on the road to health because your health is your greatest asset. Please, if somebody you know has digestive issues, share this with them. It can be helpful for them to see that there are solutions. Again, we appreciate you watching. Take care.